Good morning or good afternoon, wherever you're calling from. My name is Linda Groarke, and I am the Program Administrator for Continuing Medical Education for Piedmont Healthcare in Georgia. Piedmont Healthcare is, I believe, the largest health system in Georgia. We have 27 hospitals plus physician practices and urgent care. We have nearly 50,000 employees and 3,600 providers, and we've been joint accredited since July 2023. We had 4 legacy programs, 4 legacy CME programs, and then 2 nursing legacy CME programs. So I've been doing CME for the system for about 12 years now. And one of the things I wanted to do was to try podcasts. Oh, I also have no disclosures to report. So just a quick overview. I'll give you a little background. I'll talk about the survey methodology and key findings. Then I'll talk about the insights we got, our interpretation, and then some opportunities and benefits. And then, we've identified some barriers, next steps, and then some questions and answers. So basically, we got a new learning management system where we could now offer podcasts. And so that really encouraged me to go ahead to try and look at this. And then the system started producing podcasts for the general public, which I was very intrigued with. And I watched a few of them, and they were well done. However, they were not on the same level that would be for professional education. So there's no way that we could tie those two in together and make it an educational thing. So that's why we're exploring podcasts specifically for professional education. Obviously, we're exploring podcasts because of the growing use in CME and CPD. It's a great engagement tool if done correctly, and it offers flexibility for learners. There's a huge audience out there that just almost learn exclusively by podcasts, or that's what they make the time for. So that's what we're doing for that. And we did 2 surveys. The first one was to gain insights from other programs on developing podcasts, and then to also assess the interest, preferences, and potential barriers to podcast use in our system. First was who we surveyed. We did a provider survey, and we did this during August and September of 2025. We reached a total of 4,484 people, and that was through our mailing list, our individuals opting in for newsletters on our LMS, and then RSS attendees. I tried to get it to put in to the employee newsletters that went out. We have 2. One comes out once a week for all employees, and then another one comes out for providers, but I just could not get the permission at that time. So I had a total response of 209. I just want to kind of say that a little bit of that is skewed because of the RSS attendees. Like most other big hospitals, we have a lot of RSSs, and a lot of them are tumor boards. And we're a very big cardiac facility. We do everything for cardiac, including up to and including open heart surgery. So our total response rate was, very disappointing. It was 4.6. And then we did a program survey, and we did that in September of 2025. So we reached out to 76 programs, 20 responded, and 7 completed the survey that they complete that they do offer podcasts. And that response rate was a little bit better, not much, not by much, but it was at 26%. The provider survey was an online emailed link to SurveyMonkey. And we had 16 questions, and it included multiple choice and open-ended questions. And then the program survey was also online emailed to SurveyMonkey. We had 19 questions, and that included multiple choice and open-ended questions. So we had this two information sources that we were able to put together. There was a fair amount of overlap in the questions between the provider survey and the program survey, so we could have a basis of comparison to see where there were similarities and where there were differences. The demographics was a broad, I mean, you know, we are joint accredited, as I mentioned, so we also do dietitians, social workers, PAs, and athletic trainers. So we got a fairly broad response, but the couple of interesting things was 67% of the respondents were non-physician. The largest group, of course, were nursing. And I also broke out nursing into APPs and regular RNs and then the PAs. So we had a pretty broad representation, I think, of the people who usually attend our conferences, participate in our RSSs, and, oops, sorry there. So there's a fair number of limitations to these surveys. One was the sample bias. I mean, just people who are inclined to respond are going to skew your results. Of course, the very low response rate, which was disappointing, included in the sample size was small. As I mentioned, and you'll see this in some of the results later, that it was skewed towards oncology and cardiology. And what surprised me was how it was skewed toward the non-physician, because physicians attend most of our RSSs along with other staff, but they're the biggest attendees of those particular activities. And then we had data analysis challenges with open-ended questions. Even with SurveyMonkey and the way that they can combine responses into categories, it was still a lot of information to go through and, you know, analyze and try and come to some conclusions. Our findings. Provider listening habits. The vast majority, 94%, listen to podcasts, and about half listen weekly or monthly. So there's enough of an audience out there and interest that we figured that we could definitely put something together and that we would have enough interest to do it. And some of the comments from the survey, for the provider survey, were that these were just, it was a great idea. They loved it. They would really like to see it. And one of the things was they wanted to see non-provider a continuing education credit. The listening habits. Most people are multitasking when they're listening to podcasts. And you'll find that, I think, with any podcast that, you know, most people are doing it. Commuting is a big one, but also exercising. Usually at home when you're multitasking, either cleaning or, you know, preparing meals. So people are multitasking when they're listening. You know, Apple Play was the most prominent, but, you know, there was a big you know, thing with the different, you know, platforms that you can go to. What I couldn't discern was that when they say the other, is that like the platforms, the individual CE platforms for some of these podcasts? I just could not get that information out of this survey. The vast majority of listeners who responded to our survey said that they use it for educational and professional development. That's the highest. Health and wellness was the next one, and they really liked stories and interviews. And then we asked, which podcast do you listen to most frequently? And most of it was medical specialty by discipline. There were a lot of responses where it was specific podcasts to their specialty. Another interesting finding was that the opportunity to earn CE credit was a big factor in participating and listening to a podcast. However, when we looked at the information from the programs, less than 25% actually claimed credit for listening. And I know from my own experience is that we might have, 200 people attend a conference and 130 put in for CME. So I guess that's kind of just one of the things that happens. And if, it comes through here with the other programs. There was pretty good correlation on the preferred formats for podcasts. The solo commentary and expert insights were a little bit higher, well, significantly higher than in the provider survey than they were in the CE program survey. Interviews were higher, and that's going to be the most common forecast in the format in the CE program survey. But case stories and case studies and stories were still high. So, I think that kind of gives you an idea of what we want to focus towards if we decide to go ahead with producing podcasts for CE credit. I found an interesting change here was that the provider survey had 10 to 15 minutes was an interest, but there's no 10 to 15 minute podcast offered by the CE programs. There is a finding that 9 out of 10 people would be interested in a micro series of related podcasts of about 10 to 15 minutes in length. These would each have their own objectives. They would, be related to one another, and then they would include different resources as well as the evaluation and the test. But from both of these, it seems that 30 minutes seems to be the sweet spot when it comes to the preferred episode length. And I got a comment from one of the clinical reviewers of the podcast that the system is producing is that 15 minutes was like too short for him to settle down, get into the podcast, listen to it, and then go back and take the test and the evaluation in order to get CE credit. So he suggested, 30 minutes would be the perfect length, that it would make it worth his while. So that's just an anecdotal finding. Big take home from this is they have to have content that interests people, or they're not going to be coming back, and you're not going to be able to create engagement with the populations you want to serve. So again, not interested in content, topics not relevant. More than half the respondents gave that as a reason. Factors to listen regularly, topic variety and continuing education credit, content usefulness and relevance was also a little bit higher than the other ones there. So we really kind of the take home from this slide is you really have to create a podcast that's going to appeal to your target market. And then you also have to figure out who that is going to be. We did ask about topic preference, and again, cardiac was high because of the RSS skewing, and cancer care. But medical imaging was very high. We do have a lot of sonographers and other imaging professionals join in some of our RSSs, especially the ones related to cardiac imaging. But the most frequently listened to medical podcasts that were listed came up as Curbsiders, Huberman Lab, and Research to Practice. And what these three podcasts in particular had in common was that they all combined educational depth with engaging delivery. And each of the episodes delivers a clear, practical takeaway. So that was for us an indication of what format we would have to take if we decided to go ahead with producing podcasts for Piedmont Healthcare. Primary care physicians were the target audience in all the CE programs. It's interesting because specialty physicians were the ones who really wanted the content, and that's where a disconnect we saw between the CE programs and the providers. Nurses are our target audience, as are advanced practice providers, but primary care physicians was the primary one. The most common frequency was monthly, 43%. This can be a challenge in engaging an audience because the frequency is just not enough to have them coming back. So bi-weekly is probably the best place to put that. One thing I noticed was that the programs had difficulty quantifying their success because of the program podcast metrics. Because some of these podcasts were on other platforms, they were not really able to determine their engagement rate or unique downloads. Two of the programs had a subscription service where providers could get on and for a small fee, take a number of podcasts for credit. The other things that I think would be useful are to look at the clicks to the program's website if the person has not gotten this podcast through the platform. For instance, if they're using Apple or Spotify, as well as the clicks in the resource show notes can be another indicator of how effective your education is. And then clicks to the organization's main webpage. I think primarily, continuing medical education serves as an outreach for most of the institutions. So this is a way to check and see how many people are engaging in your other CME activities, to see if it's resulting in any contact with other physicians for referrals, and seeing if anybody else can come in and, just track the impact that you're having on the facility, because, the return on investment is going to be something that you're going to want to demonstrate, especially after the program gets started. These two statistics from the program one was that they overwhelmingly considered podcasts successful and a good return on investment. Again, it was very hard to quantify this with the information they provided. They could, give me some basic information, but nobody could give me a comprehensive overview of what it looked like. The provider survey, again, there was high level of interest in podcasts as a source of professional education. And that's going back to the 90% of people who would be interested in getting CME credit for watching a podcast. The opportunity to create specialty-driven episodes while weaving in broader cross-cutting themes is another way that we can engage people. The only thing is, trying to create specialty-driven episodes, you're basically reducing the amount of exposure and content that's going to appeal to your whole target audience. Relevance of target topics to the target audience is key. And we saw this in both the barriers to listening and the factors that would make them more inclined to listen. One thing that came up in a lot of the comments, and again, because 67% of our responders were non-physicians, was offering credits for non-physicians. %94 of respondents already listen to podcasts, and half of those are tuning in daily or weekly. 91% say CE credit is a factor in deciding to listen to a podcast. Again, this was interesting when you're finding that not everybody is claiming CE credit for listening. And what I said before is 30 minutes seems to be the sweet spot. Although we had 9 out of 10 express interest in 10 to 15 minutes of micro series. Again, this would be like 3 or 4 topics broken down into 10 or 15 minute micro teaching, and it would all be related, and it would be, easier to take in smaller chunks. So we think that's why there's a lot of interest in the micro teaching. Podcasts can be useful additions. There's a lot of ways to engage with your audience, and podcasts are very simple and effective ways to do it. Currently, they're not used by the vast majority, 64% of the programs that responded to the survey. One of the things that came up was that technical barriers should be considered, as podcasts require a lot of resources. And that's for producing, finding the content, finding the subject matter experts who are willing to put in the extra time to do the things necessary for something to be credited for CE. A lot of people were doing things in-house where they were doing it on their own software and things like that. And, there was a big learning curve on using the editing software. For us at Piedmont, they're very conscious of the brand image. So everything would need to be done professionally, and that is considered a considerable cost. I had gotten an estimate of $3,400 per episode to help us record, produce, edit, and publish podcasts. And then you need to establish and track performance metrics to determine the impact and return on investment. How do you know if you're being effective if you're not tracking things? And I think it's helpful to have these metrics in the forefront when you're developing your program so you can track it better over time. As I said, most programs do not currently offer podcasts. A significant number of listeners generally do not claim CE credit. It can also expand the exposure of the institution. As a lesser known institution, you can have national or even international coverage depending upon the quality and the topics that your podcast is offering. Resources required can be costly and time consuming, and you are able to reach different audiences because people who are listening to podcasts, they're available 24/7, they're available on demand. That's not always the case with your other traditional continuing education programs. Those are usually in-person, live events, or regularly scheduled series, or at least that's what it is for us at Piedmont. Barriers and opportunities. The one key thing is probably going to be technical barriers and production costs. In order to create a quality podcast, you're going to need to invest a lot of time and possibly money. So there needs to be a cost-benefit analysis to see if it's worthwhile to pursue podcasts. The other thing is identifying a niche market. Because there's so much competition out there with other podcasts, you have to make your own a little bit unique. So there's some really quality podcasts out there that have branding associated with it that's going to draw people to that anyway. I don't know that we would have that initially, and that may be difficult to quantify so that going forward, you're going to be able to continue to offer podcasts. The one thing that really is going to take a lot of time is the bandwidth of the staff to produce a high quality product. In addition to having an outline and scripting and finding an engaging host or hosts that's going to give the podcast some continuity, identifying and working with subject matter experts that are willing to do the extra work that's necessary to develop a podcast. Because each podcast would be considered a separate activity, they would all require a separate application. They would require evaluations, they would require knowledge tests, and they would require disclosures from planners. And the planners and the subject matter experts that are involved with producing the podcast. And I already mentioned the competition with existing podcasts and unclear goals. I think the findings from the survey show that the relevant topics for a target audience are going to be key. And this is going to play a major factor in your overall planning and development of the podcast, is that you have to decide what your focus is going to be. Another one is the balance of expertise with personality for your host. Since most of the podcasts and most of the interest of the listeners is to have interviews, if you have a dynamic and engaging host, that's going to be able to give some continuity to the whole podcast series. There needs to be educational depth with engaging delivery. When we first started doing the public podcasts, I listened to the first couple of them, and they were really well done, but the education level was not up to professional education because they were produced for a general public. You need to have that that depth in order to make sure that you're going to keep it accredited and that it's worthy of continuing education credit. And that means delivering, information that is evidence-based, that's peer-reviewed, that's available to the learners. And I mean, you can always have additional resources listed in the show notes. So these are the things that are going to make it successful. The other thing is including non-physicians for CE credit. Just a quick aside here, elements needed for each CE accredited episode are clear learning objectives. Each episode needs their own. Of course, we need a short assessment to validate knowledge, an evaluation, bibliography, and resources for further study, and then the financial disclosures for faculty and planning. So this can take a considerable amount of time. We do have resources at the system of librarians who can assist with identifying evidence-based articles and other resources that we can make it easier for the subject matter expert to come in and do their planning for the episode. But again, one thing I kept getting from the programs was that it takes a lot of time, energy, and effort to really make a successful podcast. The opportunity is engagement. It's another way that we can engage the audience that we would like to reach. And it also enhances your reputation. I mean, when we do our live conferences, we're obviously spotlighting our own clinicians, many of whom have national or international recognition for their specialty. And again, Piedmont is known for their cardiac care. It can also help to focus on service lines. And again, if you're out there as an expert on clinical excellence, that can help to generate referrals to your institution. So even though podcasts may cost to produce, they can also result in referrals. That would be a very difficult thing to track, but I think it's something that needs to be thought about. I think the key focus for the next step is to identify the ideal target audience for your podcast. And again, in order to differentiate yourself from the other podcasts out there, you have to determine your focus. Additional research into the popular medical podcasts to find out what worked for them would be very helpful, although this may be very difficult because they view you as a potential competitor. The next thing, as a joint accredited provider, is that we can make these podcasts interprofessional, but we really need to have a planning team that's interprofessional to help us guide us through that process. Next step is to develop a proposal if we decide to go on with the feedback from the planning team to outline the budget, staffing, and other practical considerations. One of the thoughts I have is to create a clinical companion to the existing general public podcasts so that you're using the same subject matter expert for both. So that makes it easier to arrange for recording, makes it easier for preparation, it makes it easier for editing and producing. And then, to make a pitch to administration at Piedmont if we decide to go on and move it. But again, the challenge is going to be who are we trying to reach? And what does the interprofessional planning team feel would be the best target audience? What would be the best, types of lectures to put on podcasts? And what would be the appropriate focus for Piedmont? Wow, this went faster than I had expected. I probably should have done a 30-minute instead of an hour. I am basically done. Although I do have some questions for you. Basically, do you think this information will help you move ahead with using podcasts as an enduring material? You can put your answers in chat, or you can unmute yourself. Okay, we did not explore, the question from the audience is, did you explore using AI to assist with podcast development? I have not yet. And the reason for that, this is a very early looking into the possibility of doing a podcast to just see if there's enough interest that we can pursue it, because there's going to be a lot of planning that goes into it even before we produce our first podcast. Okay, I see no other questions. Any challenges that you see in developing podcasts? I did list a number of barriers. And you have to think about what's your main impetus for creating podcasts. Okay. I do have my contact information. The last name is a little difficult, so you can also use our generic cme@piedmont.org if you would like to reach out to me and get a copy of this slide presentation. Okay, the question is, I really need to know more about podcasts, as I have been sensing an urgency to create CE for this. We have some podcasts already in the works, but no CE. Given that it would be coming from the continuing medical education program, I think it only makes sense for us to offer CE as well. So we would pursue getting CE credit for our podcasts. Well, if nobody else has any other questions, I think I'll wrap it up and ask Lauren if there's anything else I need to do.
Sorry, there's another question from Penny. She said,
Okay.
I am not sure how to set up a podcast for credit.
Okay, it's like any other enduring material. You would need to go and do your needs assessment. What we do is we have an application in our LMS that goes into everything that covers needs assessments, professional performance gaps, knowledge needs, skills strategy needs, and performance needs. And all that needs to be addressed before you come up with a podcast topic. You need to remember to include your disclosures for the presenters, and this can be done in the show notes or on the information about your podcast. Then you need to have an evaluation or an assessment. And we can do this on the LMS where you would ask, 3 or 4 multiple choice questions. You need to be able to give feedback to the participants on the incorrect answer. They need to do an evaluation, and there has to be a resource for bibliography and other resources for the learner to consult if there's any interest in pursuing this a little bit deeper. So those are the key factors that you need to do in order to make it accredited for CME.
He has a follow-up question about that. He said, that is great. Once that is done, how do you disclose to the audience?
You can do a disclosure right at the very beginning where you can say, I have no financial disclosures. The key thing is you have to remember you have to include the planners in that, because that's something that's frequently cited as a problem for providers when they're doing continuing education. We also have on our learning management system, we have the registration page, and we can put our information on there where you can put the disclosures for the faculty and planner on there, so that this meets that requirement that it informs the learner before the activity starts.
Thanks, Linda. There's another one. There's another question. Linda, just a general comment. We've had some experience with podcasts and have low rates of claiming CE credit. Any thoughts on how to increase the rate?
That's a great question. And I think if you make it easy for people to go in and claim the credit, that's probably going to help. But it has to be, I think, something worth their while. And that's where I think those 30 minutes seems to be the sweet spot. Again, I haven't really started. This is our first look at podcasts, and, we don't even know if we want to pursue it at this point. Given the low response rates from the surveys that we had, I would need to do some more, more in-depth surveys to really gauge the interest. And then, that would be one of the questions I think that I would ask is that, how do you feel about getting CME? Would you still listen to this podcast without CME? Because there is a lot of it, additional work you need to do in order to make it accredited.
Right, thanks, Linda. I think those are all the questions right now.
Oh, great. Okay, Lauren.
All right, feel free to wrap up the session and
oh yeah, I mean, if nobody has any other questions, I think we're done. I'll give you back 15 minutes to your day so you can run up, get a snack, and then come back for the next session.